we are at Dr. Postol's office. Why don't we go in and take a little tour? As you can see, here's our front desk area. Here's our waiting room, which unfortunately is not really being used right now due to all the COVID precautions. We have plexiglass barriers, just like you guys probably have at your offices right now. Our staff is wearing masks. One of our small offices here. This is Katie. She's our dental patient coordinator. We walk on down the hall. Here's our iCat x-ray machine. And then over here is the consultation room where the patients are met for the first time and their treatment case in particular is discussed and they get information. And when you walk on down the hallway here, past all the dental treatment rooms, and here is our sleep apnea treatment room. This is Delva, our dental assistant, and this is where the patient is seen. As you can see, we have the machine that scans, and it's a little more like a medical office setup.
Hi, welcome to our virtual open house. I do wish we could have this open house in person, but due to the current situation we're all experiencing, I felt like this was the best thing we could do at this time. So welcome, everyone. I get asked the question a lot, what do I enjoy most about treating patients who have sleep apnea? I also have sleep apnea and have been wearing appliance for 14 years, and I know how it makes me feel and how much better it is for my health. And not only for my health, it also helps my spouse sleep better too. So that's why I like to help patients who have sleep apnea, to help them get a healthier night's sleep, but also to help their spouse and significant others in their life get a better night's sleep also. I hope you all enjoyed our virtual tour. Again, I wish we could have done this more in person. Hopefully sometime in the future you will be able to do that again. Again, if anybody wants to come by and see our office, we are more than willing to have you come by. I hope you all enjoyed the great goodie box my staff brought by your office. And thanks again for all your kind referrals, and hopefully we are treating your patients as though you were treating them yourself. During our shutdown for COVID back in March and April, I collaborated with other dentists who also treat a lot of patients with oral appliance and helped write a book. And this book is a very basic book that goes through different reasons why patients might have sleep apnea. What it does for you is it gives you a source to give to your patients to help them understand why they need to be treated for this disease. We have had a positive response with the book so far. I think the book was written in a very simple layman terms so that people would have an easy time understanding different aspects of why it is important to get a good night's sleep and their health. And I think during these times right now with COVID, it is especially important for patients to get a good night's sleep and to get the proper amount of oxygen. So I couldn't have think of a better time to write it during these health scares right now that are going on with COVID. I get often asked, what do we do differently now with COVID to make our patients feel safe? As before and now, we do, all of my staff members wear PPE equipment while they're in the office. I also make sure we screen every patient before they come in our door to make sure they do not have any present illnesses or any past illnesses that could make them a higher risk to my staff. We also offer every patient the opportunity to have a virtual visit with our nurse and myself. Every patient who comes in our office is treated with an oral appliance. One of the first things we do for them is we take a CAT scan with this machine here. And what that does is it gives us the ability to look at not only their sinuses, but also their TMJ area to make sure there is nothing to preclude them from having a good, healthy night's sleep with a new oral appliance. I'm not sure if a lot of you are aware of it, but when we have patients come into our office, we no longer have to take the old-fashioned impressions of their teeth. We now take digital impressions with a scanner, much easier on the patient, and we can keep records much easier in our office because they're all digitally stored on a computer. After we digitally scan each patient, we then now have the ability to digitally print with our new Sprint Ray printer, and we end up getting their digital models like here in our office, which is great because they are very accurate, much more so than the traditional models we used to take. And like I said before, the one great thing now is they digitally stored, so anytime we want to get new models on a patient, we can print them with this digital scanner. So anybody who's ever interested in seeing how we scan and then print our models, please feel free to give us a call and come by and take a look. What separates me when it comes to treating patients with sleep apnea is my 15 years of experience, having treated close to 1,200 patients and having a nurse on staff who helps truly educate these patients of what sleep apnea truly is all about and how an oral appliance can help them. Nowadays, because of COVID, virtually, to meet with our staff nurse to discuss their sleep apnea and their healthcare needs. During this visit, not only does she go over what sleep apnea is and how an oral appliance can help them, she also will discuss with them in their insurance and any financial concerns they might have. So the patient then is reappointed to see me for the actual treatment of their sleep apnea with an oral appliance. They know exactly how much it's going to cost, how much their insurance is going to pay, and we have less problems with these patients because of the fact is that everything is brought forth before they ever see us for treatment. Most physicians, they truly have a big caring heart for their patients. Not only do they care about them that they're as healthy as possible, but they also care that the patients are taken care of in an appropriate manner and that we do not burden these patients with high out-of-pocket costs. So because of that, we are in network with not only Medicare, but also other local insurances. We are an unrestricted provider with most healthcare insurances in our area.
I'm Belinda. I'm the nurse here at Dr. Postol's office. I'm responsible for the initial contact with all of the patients that come in to see Dr. Postol with questions about oral appliances. They meet with me for about 40 minutes. In that time, I go over a lot of things that they haven't had the opportunity to ask just due to time constraints in the medical field. We go over their sleep study, their health history, treatment options, including a CPAP, an oral appliance, and surgical briefly. I don't get into too in-depth with surgical. And we feel very strongly that the better educated the patient is, the better choices they make for themselves. So it's a very nice opportunity at no cost to them to ask a lot of questions and get their questions answered and perhaps investigate things a little further. We do that because it does not waste Dr. Postol's time then. As far as if they're not sure if the oral appliance is right for them or not, we can answer all of those questions before they get to that point. I love my job because I love being able to help people. I love being able to guide them and kind of navigate the system with them. I have made calls for patients for CPAP who really should have been using their CPAP but were having struggles, either had a change of providers, a change of insurance, and just kind of got lost in the shuffle. And so we're not always just about the oral appliance, just like the physician staffs that we work with, we're really in the best interest of the patient. So it's really a very rewarding job.
I am Kevin Postol. I am a general dentist in Baldwin, Missouri. I've been practicing for 30 years coming May of 2021. I also treat patients who have sleep disorders like sleep apnea, and I also treat patients who have TMJ and facial pain. I've been treating patients who have sleep apnea now going on 15 years. I collaborate with fellow healthcare professionals both in my area and nationwide, because every patient who has sleep apnea has to not only be seen by me, but they also have to be seen by a sleep physician to be diagnosed first, and then they get referred to our office for treatment with an oral appliance. During the 2 months that our office was closed for COVID, we did multiple things, including a lot of work around our office, but we also found out through Hunter Engineering that they were collecting CPAPs to be used as portable respirators for local hospitals. So we decided that we could help them by collecting CPAPs that we then gave to Hunter Engineering, that they turned into respirators that are used currently at Barnes and Missouri Baptist hospitals. What I enjoy most about treating patients who have sleep apnea is helping them become healthier and helping them get a good night's sleep, and hopefully helping them extend their life so they can enjoy it with their family and friends for many more years to come. I have a new motto in my office this year: to add 100 million years of lives lived with vitality. I would like to thank all the sleep physicians in the greater St. Louis, St. Charles, and Wentzville area for referring us patients through these many years. And if you ever have any questions, feel free to call our office at 636-394-6044, or you can, even if you feel a bigger need, please call me on my cell at 314-249-0123. I'm always here to help you and your patients. I hope you all enjoyed the quick tour of our dental office here in Baldwin. I also hope that you enjoyed the snack box we sent to you for your enjoyment. And please, again, if you have any questions ever, feel free to reach out and connect with myself or my staff, who can answer any questions that you or your patients might have. Thanks again, and hope to see you real soon.